good afternoon, and thank you for joining the Superior Health Quality Alliance Roundtable conversation. My name is Kim, and I am joined by my colleagues, Janae and Jerry, as well as our guest speaker today, our very own Superior Health Quality Improvement Advisor, Amy Magner. For those of you that have been joining these meetings over the past few weeks, or actually even for the past year, welcome back. If you're new to the call, we are really glad you're here. We host this 1-hour session on the second and fourth Wednesday of the month. The first half of the presentation is an educational format, and then the remaining time will be for Q&A. Now, besides learning from our speakers, you have helped your fellow nursing home leaders on this call. In the past, you have shared resources and strategies, and we encourage you to continue to do so during our Q&A session. One thing I'd like to ask of you is that if you have any pebbles in your shoe or things that you're struggling with or trying to figure out, send me a message in Zoom chat about what this issue is, or your pebble or in your shoe is. Or you could put your suggestion in the survey at the end of the session, and there's a very good chance that we will be using your suggestion or your issue for a future session. We're going to put the link for the PowerPoint presentation into chat momentarily. You can also use that chat box to share any comments, questions, anything that pops into your mind during the presentation, and then we'll use that for discussion later on in Q&A. All right, well, before we get started, I'd like to just do a brief review of COVID up-to-date resident nursing home rates for the nation and for our 3 states that we represent here on this call today. As a nation, week ending February 12th of 23, resident up-to-date rates are at 52%. Now, Michigan is at a little bit lower at 48%. Minnesota, you're at 70%, and Wisconsin's at 62%. So how does your facility compare to these rates? Are you having difficulty setting up vaccination clinics? Are you having any NHSN reporting issues? If you'd like to drop your rate into chat, we'd like to see how our audience compares to the nation and your state averages. And if you do need help, reach out to me or any of our QIAs. We'll drop some email addresses in chat in just a little bit in case you want to reach out to any of us. We do have great news for our Michigan participants. Michigan has a limited source of mobile vaccination clinics. Just before like last week, we only had one source for a mobile vaccination clinic that was only going into a tri-state area. And think about how big Michigan is. But Superior Health recently contracted with a mobile vaccine provider now that will go anywhere in the state. Now, we're not leaving Minnesota or Wisconsin out. We also have mobile vaccine provider options for you too. So if you need help in that area, again, reach out to us and we'll see what we can do for you. All right, well, today our presentation is about respirator fit testing. And Amy Magner, the floor is yours.
Great, thank you, Kim. As Kim had stated, for today's presentation, I am going to discuss and present information regarding the N95 Fit Testing. So I'm also going to address, not only in addition to the N95 Fit Testing, but I want to just touch base and talk a little bit about some of the areas that many of the facilities that I have worked with have just brought to my attention that they have like maybe some concerns or want further clarification regarding improvement of maybe their N95 testing processes or in regards to their respiratory protection program. And so for this presentation, for the objectives for this presentation, I'm actually going to review the Occupational Safety Health and Administration, or OSHA, respiratory protection program. So if your staff are required to wear a respirator N95, which I'm sure most facilities are, you should, if not already, have a respiratory protection program implemented or in place. I also will review the qualitative and the quantitative respiratory fit tests, Sometimes those can be confusing, especially if the individual who's actually performing your fit testing doesn't really have a clear understanding what the difference between those two tests are. I just want to give a little bit more information. So again, I'll briefly explain the difference between the two. However, out of the two, being that qualitative fit testing is more specific to the N95, I will focus primarily on that qualitative fit testing. I also will review fit testing requirements for respiratory protection and preparedness, as well as fit test results. I will also include the requirements and qualifications to conduct a fit test. I also will spend some time reviewing the OSHA medical evaluation questionnaire, and then review the updates for the N95 respirator usage in the skilled nursing facility environment. And then the presentation will conclude with a Q&A session, as well as any follow-up conversations that we may have. So if, like I stated, if your facility and your staff are wearing N95s, you should have a respiratory protection program implemented. So when developing or maintaining a respiratory protection program within your facility, you want to make sure that you adhere to your federal and state regulatory requirements. So each facility should follow and review their state code. So that could be per your Department of Human Health Services. In addition to the OSHA respiratory protection standard, it's the standard 29 CFR 1910-134. And that was actually went into effect on April 8th of 1998. So you can actually find that protection standard on OSHA's website. But if you have a respiratory protection program that you've already implemented, that you maybe are going to be updating, or you're going to be implementing one, I would encourage you to go to their website and look at that that standard, because it actually is a nice guide and outline that what you should really be inquiring or incorporating into your programs. In addition, every respiratory protection program requires a program administrator. So you should have a designated person that's responsible for any documentation and written work, especially to site-specific procedures in your facility, along with the respirator selection that your facility is using, and also medical evaluations, as well as use of respirators. Now, the standard requires the employer to provide effective training to employees who are required to use respirators, which I find really interesting in the facilities that I talk to when I evaluate and assess their infection control programs, is that they may be doing N95 or fit testing. However, they're not actually providing training and education related to fit testing or how to properly don and doff a respirator. So you want to make sure that if you do have this respiratory protection program, which you should, that you are actually providing your staff with effective training. The training must be comprehensive as well as understandable, and it should recur annually or more often if necessary. The information that you provide should be basic information on respirators, and the standards also reinforces that the respirator shall be provided to each employee when such equipment is necessary to protect the health of such employee. So in regard to your protection responsibilities, so in addition to creating and having a respiratory protection program, as an employer, you do have specific responsibilities that are expected that you need to adhere to for all your staff that are utilizing some form of respirator. And it doesn't necessarily have to be the N95, but it does pertain to any respirator that's being utilized in your facility. So all employees that, at the time of completing any education or specific training for respiratory protection, should be done during paid work hours. So you shouldn't be asking staff to come in on their off days or off hours, or having them come in and not paying them. So they should be paid for their training. You also should designate an individual to be your facility's respiratory program administrator. Again, that is a requirement. So you have a designated person, and that person should be appointed. And so when you appoint a person, you want to make sure that they are going to follow through, that they are competent. That person is appointed as your administrator, will also oversee the employees, vendors, maybe contracted staff, and they will also be responsible for creating your respiratory protection program. Now, this could be your nursing home administrator, maybe your infection preventionist, director of nursing, or DON. But you want to make sure that you select a person who will be compliant, follow through, and accountable. Employers are responsible for identifying all respiratory hazards within your facility, such as COVID-19, influenza, measles, and tuberculosis. Any hazard that could have a negative impact on staff as well as residents and visitors. So being that the National Institute for Occupational Health, or NIOSH, evaluates respirators, you want to be sure that the respirator that your staff is using will be effective, and it should be provided, it should be a NIOSH respirator, being that they are the ones that actually evaluate the respirators that we are using. So a great example would be your N95. Employers are required to provide staff with respirator replacements in a timely manner, especially for staff who are required to wear respiratory protection when providing care to residents or patients. Employers are responsible for providing a medical evaluation, training, and fit testing for all employees, as well as you want to make sure you provide a plan for accommodations for an employee who may not be able to use a respirator. It is important that an employer uses, as an employer, you're able to provide your staff with a selection of respirators. So you want to make sure that when you are providing fit testing, that you really have more than just one option for your staff, because if your staff member is not able to use what you have provided, that creates a problem. So you have to have a selection. It is important that an employer that you not only provide a selection of respirators, but you also, if they're not able to wear N95, you should be able to accommodate them with alternatives. So if a staff member is not able to wear like an N95, you should be able to provide them with what we call an elastomeric respirator, or a PAPR, or a powered air purified respirator. So you want to make sure that you're providing your staff and protecting them with alternatives if an N95 is not accessible. Now, in addition to the employer having responsibilities, your employee also has responsibilities. And so I encourage facilities to make sure that you are encouraging in providing this information in your training. So again, the responsibilities that we expect your staff to follow would include to make sure that they complete their medical evaluation questionnaire prior to a fit test. And so when we talk about that medical evaluation questionnaire, that has to be completed by the staff, and they have to use the medical evaluation questionnaire that you provide as the employer. They can't use their own. A respirator fit test must not be completed until the medical evaluation is actually completed. So meaning that if a staff member comes in, they want to be fit tested, they have to complete that questionnaire before they can actually be fit tested. So it is their responsibility that they do complete that form and they have it completed before the test. And then they must complete the medical evaluation should be completed or revised every year, because annual tests should be completed, or if there's any changes. And then the respirator medical evaluation, as I stated, that the medical respirator evaluation must be again completed before before your staff member completes their fit testing. That's important. And I see it a lot in facilities where they actually will do the fit testing, and then they'll go out and they'll ask the staff member, oh, quick, I need you to fill this questionnaire. Just so you know, before an employee can be fit tested, they must complete a respirator medical evaluation and questionnaire. And what's really important about the medical evaluation, it must be assessed and evaluated by a physician or a licensed healthcare professional. So I'm going to talk about in just a second, who can actually is qualified to do fit testing. So you'll find that, you can designate fit testing to any person that you feel is compliant and competent. However, when it comes to the medical evaluation, it has to be completed by a physician or a licensed healthcare professional. So a medical evaluation is required, as I stated, prior to fit testing, because being that the N95 is tight fitting, the source control can put a strain on the person's body, which in turn makes it harder for that person to actually take a breath. And so when the person can't breathe, that can cause anxiety. It can cause lightheadedness. We don't know how a person's actually going to tolerate this process. So it's very important that their medical evaluation is assessed prior to the testing and by a healthcare licensed professional. The medical evaluation will help determine if a person is able to use an N95 safely. If an employee has not completed the medical questionnaire, and or if the medical questionnaire has not been reviewed by a physician or licensed healthcare professional, the fit testing should not be completed. The respirator medical evaluation questionnaire must be completed prior to wearing a respirator. So often I will, spend in facilities and staff members will have an N95 on and they haven't even been tested. They just like, you need to have the mask on before you can go into a resident room because they're COVID positive, and they put the mask on. So just keep that in mind that a staff member should not be putting any respirator of any source on unless they've actually been fitted for that respirator. And if a staff member tells you they can't put it on because they haven't been tested, that is accurate. So you want to make sure that you are getting those individuals tested as quickly as possible. Again, the medical respirator evaluation also aids in determining if the employee is able to wear a respirator, because you definitely don't want to put a respirator, have a person put a respirator on and they can't wear it. And then when completing the respirator medical evaluation, the information should be current and it should be accurate. So once an employee has completed their medical evaluation questionnaire and submits their information to the fit tester, the employee's information now must be protected. And I find it very interesting that a lot of facilities don't know this. So once your employee actually completes that questionnaire, that is protected health information. So the information provided by the employee is confidential and it should be handled as protected health information. So being the information is evaluated by a physician or a licensed healthcare professional, the employee's health information should be protected by HIPAA and should be stored separately from HR records. So if you have medical evaluation and it's completed, that information should not be stored in the HR file. They should be kept separately and locked in a private location. Medical respirator information should be updated annually as needed. It's also important to know that evaluation should be updated if an employee has any changes related to maybe longer respiratory changes, if they have any cardiac changes, stroke, dental surgery, facial surgery, or extensive weight gain or loss. So it's really important that when you are going to fit test your staff, that's why training and education is so important. Not only do we want to teach them how to actually don and doff the respirators correctly, but we also want to include this information that if they have any changes, any significant weight loss, or weight gain, if they've had any dental surgery, if they've had any trauma to their face, if they have any extra facial hair they've grown, that's all going to compromise that seal on their respirators. And so they need to update your facility or your program administrator so they can be reevaluated. And then the question often is asked is, again, can any person perform a respirator fit test? So OSHA does not require certification to perform a fit test. However, OSHA's standard does specify that fit test administrators should know how to conduct a test. And so I often will ask those individuals, like nursing home administrators and IP, the individuals that are actually performing their fit test, have they actually assessed the individual and watched them actually perform a fit test? And the important thing is, if you are assessing and monitoring your fit tester's compliance and competence, you also need to know what the protocol and process is. Because if you don't know what the expectations in the process is, the correct way to actually fit test, you wouldn't even know if that person is actually doing it right or wrong. So again, I've had facilities having their environmental service staff or dietary staff or director of activities actually doing fit testing. Again, anybody can perform that fit test, but as overseeing your facility as a director of nursing or a nursing home administrator, IP, you want to make sure that those individuals actually are able to do that effectively and they're compliant. So again, any facility can deem a person, to do their fit testing as long as they're competent and as long as you're following OSHA guidelines. That's what's important. You want to make sure you're following OSHA guidelines. If you don't know what the OSHA guidelines are for respirator fit testing, they offer great resources that we've provided in this presentation that you can actually access. So any person who has delegated the task regarding fit testing should be properly trained. So again, although no formal training is required or deemed mandatory by OSHA, the individual should understand how to properly conduct a test. So remember, a respiratory medical evaluation questionnaire must be completed before a fit test. So that means that a person performing your respirator fit test does not need to be a licensed medical provider. The individual assessing the medical evaluation must be a licensed provider. So often there is that misunderstanding that any person can perform a fit test. Well, because the medical evaluation is part of the fit testing process, they just assume that it's all, anybody can take care of that or do that. And that's not true. So you want to make sure that if you do have a person who is not a licensed healthcare professional is doing your fit testing, you're going to want to make sure that you have a person that's going to be able to be present to assess those questionnaires and evaluation before that fit testing is actually done. And it's important to also understand that a surveyor may ask you to verify that the individual who's performing your facility's fit testing is qualified. So you need to be able to demonstrate and validate to a surveyor or any person that may come to your facility through state licensure that you are able to validate and substantiate that the person doing your fit testing is qualified. Now, they have some great programs that they offer. They have the Train the Trainer programs. I definitely encourage you, if you have not already, to utilize a respirator fit testing Train the Trainer program. Many facilities find this helpful, as this program not only provides the appropriate education and training for the individual who will be conducting your fit testing, it also, you're able to properly train additional staff. So, if you have an individual who is not properly trained, training additional staff, it's not going to be effective. And again, it puts your staff at risk. So this will also help with compliance for both you and your staff. So if you do have an individual who is going to be your fit tester who actually completes a program and becomes certified, you want to make sure they provide you with that certification as well, because that would again substantiate they are qualified to perform a fit test. And then just to reiterate, to provide staff with the correct training and education prior to fit testing. This also will help reduce stress and anxiety for some people. So keep in mind, for a lot of us, the fit testing process, it's really pretty straightforward, but there are people who they often feel claustrophobic when they're going through this process, so they increase their anxiety. So you want to just make sure they know what the expectations are of this program before they actually, or the testing process. Now, when we talk about the fit testing procedure, it actually entails 3 different components. So as a respirator fit test is a way to identify the correct respirator that will keep employees as well as residents, visitors, and your vendors safe, because you're only going to put a respirator on your staff. You are never to put a respirator on a visitor or a resident or just a vendor coming into your facility. But we are keeping them safe by us ourselves being properly fit tested and wearing our source control as required. Fit testing is, again, the method for finding the respirator that fits an individual's face and making sure it provides a tight seal to help keep the person protected. So as I stated, the most commonly used respirator used in healthcare setting is the N95 respirator. The N95 respirator should fit snug on the face without any gaps. And that's what we're going to assess when we're in that initial test, as well as in the annual test. So a tight fitting respirator, when used properly, will filter out about 95% of the hazardous particles. So we talk about like the particles, respiratory hazards, like, as we talked about COVID-19, influenza. So any of those particles in the air, it does filter out about 95% of those. If the N95 does not fit tightly against the face, it will not protect that person. It's also important to remember and educate staff that an N95 cannot provide additional oxygen. So in the initial test, you want to make sure you're providing this information. So again, the initial test, and I'm going to talk about it in just a minute, takes about 15 to 20 minutes if done accurately and correctly. So the testing component of it takes 15 to 20 minutes. And then if you got to explain all this additional information on top of that 15 to 20 minutes, it could take a much longer. And especially if you have a lot of staff to test. That's why it's so important that you include this information regarding, how to properly put the mask on. It has to fit snug prior to fit testing, because it will decrease your time dramatically when you're testing. One thing about the N95 is also that you want to kind of reiterate to your staff in the beginning, in that initial test, is that the N95 is not effective against gases and vapors. And like examples of gases and vapors would be like carbon monoxide. So it doesn't filter those, or formaldehyde, I should say as well. Now, in the fit testing process, if the fit testing is done correctly, as I stated, you want to plan about 15 to 20 minutes. So a highly experienced individual who has done fit testing can actually do maybe like 3 fit tests per hour. As part of your facility's respiratory protection program, you should have a plan regarding when an employee's initial and annual testing will be completed. And that's what this slide really focuses on. So your initial test should be completed immediately upon hire. And so when I evaluate or assess and I talk to my facilities that I've been assigned to, I ask them about their fit testing process. And I ask them, when do they initially fit test new hires? When is that initial test done? And for a lot of facilities, it could be like as they're coming up orientation. They don't really have a plan put into place when there's nothing really set like when they actually do it. It's just like basically when the person who tests is available. I highly encourage you that is your facility that you have a good solid plan in place. And so I always encourage my homes that on that initial test, again, make that part of your new hire orientation process. Make that part of that onboarding process. If you have, and most of you do, if you're providing infection control education, that you can incorporate your fit testing into hand hygiene, PPE, and fit testing all at the same time. You can actually do a skills checkup at the time after you provide education. And that will also cover you for the initial test, validates compliance that you've actually validated their competency. And then you can put that into your stats file. And then you know it's done. So you don't have to follow up with those individuals. So no new hire should actually provide care to any resident until they've actually been fit tested. And then all new hires should be fit tested prior to the start again of their first day. Annual testing should be completed every 12 months. And so that's another question that I often will ask my facilities, like, when do you perform your annual fit testing? So the fit test is valid for 1 year. That's important to remember. Fit testing is only valid for 1 year. That's why we have to do annual testing, unless there are major changes to the user space, as we talked about earlier. So annual testing is required unless there's been changes. So recent research from NIOSH has actually confirmed that the need for annual testing, 10% of those who have been tested, when they're retested, they actually will fail using the same mask that they've been using, the respirator they've been using. So over the course of 1 year, they find that using the same make, model, and size of the respirator is inaccurate. So that's why they really encourage, we put that 1 year. And so how do you incorporate the annual test? So I often will tell facilities, if you have a skills day, or a lot of facilities call it education day, that you incorporate your fit testing into that skills day. That way you get all your staff done at the same time, kind of keep them on that same annual track. You may want to incorporate that into your staff's, maybe their anniversary day. And so you're just going to want to make sure that you designate a person who's going to follow through and monitor those annual dates. Because if a surveyor comes in and wants to see your fit testing test, and they see that a staff member has exceeded that 12 months, that could actually, and I've had facilities actually have been cited for that. And then with the fit testing procedure, it's also important that the staff member actually does a seal check. So when they put their mask on, each time they put their mask on, even though they've been fit tested, that they actually do a seal check. So it's important that you understand that a seal check is not a fit test. So a seal check is used to see if the respirator is positioned on the user's face correctly. So what happens is a user should do a seal check, as I stated, every time they put the respirator on. It's important to remember the seal check, again, is not a fit test. So to do a seal check, the user would put the respirator on and then verify that it's fitting snugly on their face. They put it on their face, kind of shape around their nose, and then have them place their hands on both sides on the side of the respirator, and have them exhale. If they can feel any leakage out the sides of that mask, that means they don't have a good seal. And if they're finding they're not getting a good seal, either they need to reposition their mask or they may have to be retested. For us that wear glasses, that's how I can always tell if I have a good seal or not. If I have my glasses start to fog up, that's a good indication that I don't have a good seal. And so that's how I've actually found that I wasn't getting a good seal with my N95. And so I had to use a different type of mask just because my glasses kept fogging up. I just couldn't get a good seal. So make sure that every time your staff member is putting on their respirator, they're actually doing that seal check. Again, that's something that you want to really encourage in your education training that you provide to your staff. Now, if the user does not have a good seal, they should adjust the respirator until there's no air leaks. But however, if they continue to get air leaks, they really need to be reevaluated. So then when performing the fit test, the procedure itself, as I stated, there are two types of tests. And it's important that you understand the difference, because when you look at your respiratory fit testing report sheet that we actually document the testing findings on, most of them will have the quantitative and qualitative. And for an individual who's not been properly trained, or there's been a lack of training, they really don't understand the difference between the two of these. And so it's very important that there's a good understanding. So the two types of respiratory fit testing involves quantitative fit testing, often use the acronym QNFT, as well as the qualitative fit testing, the QLFT. I will generalize both types of these tests, but as I stated, I will place more emphasis on the qualitative fit testing because it is specific to the N95. In regards to the quantitative fit testing, the difference between the two, with the quantitative, that actually uses an instrument to take a sample from where the individual's breathing. So it's in their breathing zone while the respirator is actually being worn. So this instrument is actually used it actually measures the amount of leakage that's in the mask itself or the respirator, and it requires a challenge agent and a probe respirator, also known as a probe adapter for a standard respirator. The quantitative respirator fit testing is performed using a condensation nuclei counter, or often addressed as a CNC, or a TSI port account, or using a controlled negative pressure technology. So with this quantitative fit testing, it is more precise compared to the qualitative fit testing. However, it is less commonly utilized because it is very complex. It is a complex procedure, and there is cost involved. So it can be a costly test because the equipment that's utilized can be very expensive. The qualitative fit testing, which is commonly known as, again, as the acronym QLFT, is basically just based on a pass or fail method. And so with the qualitative, it actually assesses the adequacy and relies on an individual's taste or smell. So where the quantitative, it actually measures how much is exhaling out of the respirator, while the qualitative is actually identifying and assessing the patient's taste, the staff member's taste or smell response to a specific taste agent. The test is done to ensure that a person can detect the taste of the tasting solution at very low levels. So when you're going through the fit testing, if there is no break in the seal, the individual should not be able to taste any of the solutions that's actually being sprayed into the hood itself. Now, although less costly, the downside to the qualitative is that it does relies on subjective information. So it's subjective response to the individual that's being tested. So a lot of times the accuracy of that qualitative test varies. But the positive to the qualitative is that it can be very simple to perform, and it is necessary. The necessary testing equipment can actually be not as expensive, so it is more economical for an organization to use the qualitative testing. Now, when using the qualitative, in addition to the different types of fit testing, there are 4 different types of solutions that are very specific to the sensitivity testing, often identified what we like to call as a taste threshold. But one of those that I'm going to briefly talk about, especially when we start talking about the smoke, is that it's more based on smell than taste. But you will see when you fill out if you probably already know, but when you fill out the record, it will have like the 4 different solution sensitivities that are listed. And so I just want to briefly touch base on each one of those so you have a better understanding when you're looking at this information and what you should be using. So Basically, for the qualitative, when you're testing for N95, the two most basic solutions that you're going to find will be the sec chain solution as well as the Bitrex. And so the sec chain solution, that is actually the sweet phase. So I always tell individuals when I'm training them when they're testers, is that if you associate the S to the S, so the saccharin sweet and the Bitrex bitter, so S and S and B and B. So with the saccharin solution, this is utilized as a taste threshold against screening, and it's intended to determine if the individual can taste that saccharin. So it should be really sweet. Where the Bitrex solution is also very bitter. And so I'm sure all of you who have been fit tested know the difference between the two, and you can really taste those. The Bitrex solution is utilized as a taste threshold screening. And so we often will use the saccharin first, and then if after the 30 inhalations or sprays, if the individual is not testing that, then we go to the Bitrex. The isomyl acetate is actually performed, and so that is more of a smell solution. So if you're going to use the isomyl acetate, this solution is used as an odor test. So this is not a taste, this is odor. If the individual detects a banana-like odor, then the taste is failed. Sorry, the test has failed. And then there is the irritant smoke, which is also called the satanic chloride. I apologize if I pronounced that wrong. So this person, and when you use this irritant smoke, this is actually going, the person can actually smell, again, it's another odor test, that the person is actually smelling smoke. We don't use the irritant smoke very often. This is also a qualitative fit test that uses a person's response to irritating chemicals. And that's what's important. If you are going to use an irritant smoke for fit testing, you really want to make your staff member aware that it can be very irritating, because with that smoke, they're actually inhaling that smoke. It actually goes into their airway. It can be very irritating to the lungs, the eyes, and the nasal passage. And so we often will tell staff members, if you're going to use the irritant smoke, which we don't usually use as very often, that they should keep their eyes closed. And the only time that you're going to use the irritant smoke is used for if you're going to be using a respirator with a HEPA filter or the P10-100 series filters. Now, just to touch base, just kind of step back, just to again, just to kind of reinforce a little information about the quantitative fit testing. Again, we don't use this very often. It's very expensive. It's a quantitative, as I said, it actually measures the concentration just to clarify the contaminants in the air, as well as the concentration of the same contaminant inside the respirator face piece, comparing the two concentrations. As I stated, the equipment is very expensive. And so it actually costs about $10,000 for the equipment to do this test. So as I stated, due to the cost, most healthcare facilities, other than larger acute care organizations, they actually choose to do the qualitative fit testing. Qualitative fit testing, as mentioned, is testing method used to assess the effectiveness of a respirator worn by an individual who has been properly tested. This testing is known as a mask fit testing. So qualitative testing is also, again, identified as mask fit testing, and it is conducted when an employee selects a tight-fitting respirator to be used in the workplace. During the qualitative fit test, the employee wearing a selected respirator is exposed to the ambient air. And this is, again, we're exposing them to a non-toxic airborne contaminant. It's usually to that sweet and that bitter solutions that they will actually taste. Now, OSHA regulations allow testers to use one of the 4 substances that I briefly talked about for qualitative testing. However, each of the substances is designed to trigger a sensory reaction, whether it's taste or smell. A reminder that if you are going to use, when you are using these solutions, you want to have an understanding what your employee is going to experience, because you want to be able to share that information with your staff member. And that's, again, that you could put that into your education before the fit testing itself, just to explain that what the saccharin is going to taste sweet, the Bitrex is going to taste bitter, just so they have a good understanding. Again, and then the qualitative fit testing is basically just a pass or fail. Now, what's important to understand is that when you're doing a qualitative fit test, this is actually one area that most fit testers kind of skip around, eliminate, or they just don't do, they do some and maybe not do any of this. So in order to perform a fit test correctly, it's important that the tester adheres to the correct procedure per OSHA standards. So again, remember the purpose of the test is to see if the seal of the N95 or respirator can maintain while the individual is actually performing movements that they would normally perform regarding their assigned duties, such as providing resident care. So remember, a respirator shifts. So when it's on their face, on the employee's face, it's actually going to shift around. So as that respirator is shifting during movement, it's going to break that seal. It's not retaining that seal. That's why we perform fit testing exercises during the testing process. So there are 8 exercises that must be completed while standing and wearing a respirator. The exercises assist in determining the respirator's ability to retain its seal when the employee is in motion. And each of these exercises should be comfortably paced, and they should occur for 60 seconds or for 1 complete minute. So again, you want to make sure when you're educating your staff regarding fit testing, let them know that they are going to be performing some exercises. Again, that's why you want to also you want to assess their medical evaluation questionnaire, because you want to make sure not only are they going to be able to wear a mask, a respirator, but you want to make sure and determine if they're going to be able to follow through with these exercises as well, especially in a comfortably paced environment. So exercising during the testing process ensures, again, that the respirator will continue to fit in a real world use, and that the tester should be spraying the solution while the individual is exercising. So these fit test exercises actually occur while the staff member and the individual has the respirator on. So you would have them put the respirator on, you would put the hood on, and then you would have them do each one of these exercises. So it's important to also remember to prevent any injuries related to falling, or if the individual becomes dizzy during the exercises. I really encourage the tester to have a chair that's easy accessible in the event that the individual needs to sit down. If they become lightheaded at all, or they feel like they're going to faint, you want to make sure that they sit down. So the 8 exercises that I have included, and these are per OSHA guidelines. These are their standards, and this is what they require, that the individual, each person must do for 1 full minute, are normal breathing. And I'm going to talk briefly about each one of these. Normal breathing, deep breathing, turning head side to side, turning head up and down, talking, and I often encourage you to use the rainbow passage, as well as grimacing, bending at the waist, and then normal breathing. Now the exercises should be completed while the individual, as I stated, is wearing, just kind of reiterate, the respirator. Before performing the exercise, the individual should be given a description of each of these exercises. So before the individual starts the testing process, you want to make sure you explain to them, these are the 8 exercises you're going to be doing and what each one entails. I also encourage facilities, when you're a fit tester, that the respirator should be worn. So you should have the staff member put the respirator on for at least 5 minutes before starting the fit test and these exercises. So make sure it's on, it's comfortable, and they're able to tolerate it before they start performing any of these exercises. So the first exercise that you want to start with would be normal breathing. Okay, so normal breathing without talking. The individual should have normal breathing while they're standing in a normal position. And the purpose of normal breathing allows the fit tester to identify if the seal is adequate. So after 1 minute, if you are able to identify that normal breathing, that they're not having any trouble breathing, that there's no break in the seal because you're going to be spraying the solution while they're normally breathing. And then you can, if you find that there's no break in the seal, they're not having any problems, then you can move to the second exercise. And the second exercise is deep breathing. So while in a standing position, the employee have them take a big deep breath in. So as they're breathing in, the tester would then again test that seal, and then you would actually use the solution. So after 1 minute, encourage that you identify that there's no break in the seal, and then you can move on to the third exercise. In regards to deep breathing, I do highly encourage you that you are assessing your staff member at the time that they don't hyperventilate. So you want them to deep breathe in and out, but you don't want them to hyperventilate. So you want it to be slow paced, just have them inhale very slowly and exhale. And then you would move to the third exercise, And so you're going to have the employee turn their head side to side. And so when we have them turn their head side to side, you want to make sure they're doing it very slowly, ask the individual to turn their head, and we tell them to turn their head chin towards their shoulder. And so we have them start either right or left. So it's just kind of chin to shoulder, and then bring back to the neutral position. And then you just keep doing the right, and again, just for 1 complete minute. So after they've completed that, then you can turn and have them go to the left, or vice versa. But the important thing is that they go slow, chin to shoulder, and bring it back to that neutral position. And then after they've actually completed the turning head side to side, again, slow so they don't get dizzy, then you would have them do the 4th exercise, moving their head up and down. You want to make sure when they're turning their head side to side and moving up and down that you don't want them to hyperextend or hyperflex. Just make sure that they're doing it at a comfortable position. Like me, I have my neck fused, so I can't really lift my head up and down. So I'm only going to go up to where it's comfortable for me. So the 4th exercise, the employee should move their head slowly, head up and down as much as they can tolerate, having the individual tip their head up towards the ceiling as far as they can, and then have them tilt their head downward towards their feet. Encourage the individual to take a couple normal breaths as they're moving the head each time. And again, make sure they go slow so they don't become dizzy. If they feel like they're going to be like lightheaded or they're starting to get dizzy because now they've got 4 exercises completed, you're going to want to have them sit down. And then you're going to have them talk. That's the 5th exercise. So this involves the individual talking out loud, and that's where that rainbow passage comes in. So you want to have the employee talk out loud while standing in one place. So some testers may ask the individual to count out loud. We say out loud, you want them to speak loud, such as if they're talking to a hard-hearing resident or a client. So you want to be able to hear that. So they can count to 1 to 100, or they can read the rainbow passage. And I really encourage the rainbow passage, and I'm going to explain why in just a second. But when the person is talking out loud, you want to be able to hear them. And so when they're talking, again, that's just normal movement of the mouth that they normally would have when they're providing care. So again, that can cause that seal just by the muscles moving in their face, causes that seal to break. And then you're going to have them grimace. So this exercise should be done, you can have them frown or you can smile. So you have them frown or smile with the mask on. And the purpose of this exercise is to test the respirator's ability to seal around the wearer's face or the staff member's face. You can use this for the quantitative as well, but we also use it for the qualitative. Grimacing is good to use if the individual is unable to bend over as well. So sometimes if the patient or the staff member can't bend over, you can use grimacing, because some people can't bend over. After grimacing, you're going to have the individual bend over at the waist and stand up slowly. You don't want to go fast because, again, they could potentially fall over, get dizzy. So they should bend forward as if they're picking up something from the floor, and then have them stand up. So while performing this exercise, it's important that the tester or the employee does not let the hood fall off their head. So the hood should stand at all times. If the person is not able to bend over, they can actually jog in place. That's why it's really important you have this conversation before the test, because they really want to wear the right footwear as well when they come to for their foot testing. The employee should be able to be instructed to breathe normally. So after bending over, they would actually breathe normally. This is to test the activities has caused the respirator to shift and seal. So you want to go back to that normal breathing, kind of right where you started in the beginning. Again, making sure that there's no seal after they've done all these exercises. Now, if at any time during the test that the employee exhibits difficulty in breathing during the test, you want to make sure that you stop immediately, and then you're going to refer that individual to a physician or another licensed healthcare professional to determine whether the individual could actually wear a respirator while performing their duties. It's also important to remember that the respirator should not be adjusted once the fit test exercise begins. So let's just say they're exercising and it's shifting, or you find that there's a break in the seal. You don't want to readjust it. If you find there's a break in the seal, that means that you should get a different model or make of a respirator. That's why it's beneficial to have more than one option for your staff. And so here's the rainbow passage that I was talking about. And so I've asked facilities, do you use the rainbow pass when you do the talking component of the exercising? And they'll say yes, and I'll say, okay, are you able to show it? Well, no. Well, if you're using the rainbow passage and you're asked to show this, or if you're using it, you want to be able to provide that you actually have it. So again, with the rainbow passage, it's really actually very beneficial to use this. So the rainbow passage is actually recommended by OSHA because it is a short and it uses phonics that actually balances the passage that reflects the variety of sounds of our mouth and movements, like when we normally talk. So if you read it, it actually, it kind of like the wording can kind of doesn't really make sense in some areas, but it actually has found that it's very phonetic, and then it actually balances the passage when we're actually speaking. And so it actually uses a variety of sounds that our mouth will make when we're speaking, especially in a normal unscripted English speech. And just so you know, the rainbow passage does come in different languages. I know you can get it in Spanish, you can get it in whatever you would need, they actually offer it to you. So if you have a staff member who English may not be their primary language, you can actually obtain it in a different language. So again, have the employees read this passage and talking out loud, and you want to make sure when they're speaking that they are speaking loud so you can hear them. The rainbow passage is used in most facilities. And as I stated, if you're going to use this, make sure that you're able to provide a copy in the event that you're asked to provide it. Now, when performing a fit test, the fit tester should really know some of the risk factors that can compromise that fit testing. So when performing a fit test, it's imperative that the individual performing the test understands what those risk factors are that can compromise the fit testing, and is able to identify those risk factors quickly. And you want to be able to identify them before you start the test. So some of those risk factors that you should be aware of is that the individual who's being tested should not smoke, vape, they shouldn't chew any gum, they should not eat or drink any liquid besides water 15 minutes before the test. So remember, the test during fit testing is actually assessing their taste. So if they chew, smoke, gum, eat, or drink anything that could alter their taste buds, this can alter that test. So we want to make sure before their test that they don't smoke or eat or drink anything for 15 minutes, again, prior to that test. And that's why you want to provide this education to your staff before they come to the test. And you want to ask them, the fit tester should be asking them, have you had anything to eat or drink, or have you smoked prior, 15 minutes before? Because if they have, you don't want to test them right away, that you may have to have them sit out and wait a few minutes. And then the other risk factor is facial hair. That seems to be a big challenge with facial hair. This can be a problem, especially around the face again, or with a mustache, because it doesn't form a tight seal. So research actually identifies that the presence of facial hair under the sealing surface of a respirator actually causes 20 to 1,000 times more leakage compared to a clean shaven individual. So what happens is the respiratory hazards, so those particles related to, COVID or flu that are actually in the air, they actually will take the path of least resistance, and then they actually bypass the respirator, and they designed and are captured in the facial hair and the particles, and they can actually get up into the mask. So there's this common misconception that the human hair can actually act as a filter, and I've had individuals say that to me, well, my beard is like a filter. Well, that's not true. The human hair cannot act as a filter, and it does capture any particles that's in the air. And if you do have an individual who has a lot of facial hair, the OSHA does provide a chart that talks about facial hair and what masks fit best for facial hair. So you just want to be aware of that. And then you might want to just tell your staff member to make sure they shave before they actually are tested. Now, if you test a staff member who has no facial hair and then all of a sudden they grow a beard, keep in mind that they need to be retested, because that facial hair will cause a break in that seal. The other key risk factor that I found, especially in the last 3 years with COVID, in regards to that can compromise a fit test, is called dysgeusia. And so dysgeusia is actually a disruption in taste or smell. Now, for individuals who have had COVID, their taste is altered. So a great example would be myself. I believe I had COVID before COVID was actually diagnosed 3 years ago, because I was sick, lost my taste. I've never gained my taste back, which is interesting. I haven't tested positive for COVID ever, but I was really sick. And I think that before it was actually identified early on in March in 2020, that's because I couldn't understand what I had. I've never regained taste, unfortunately. So for me to do a fit testing, I can't taste, which is a challenge, because if there's spraying the solution, the sweet or the bitter, and I'm supposed to taste it, if I can't taste, we really don't know if there's a good seal. So for me to wear N95, I don't know if it's beneficial for me or not, or if I have a good seal. But basically, I can only tell by if my glasses fog up or not. So just keep in mind when you're doing your fit testing, ask your staff member, have you had any disruption in your taste or smell? Because this can also be a risk factor. 25% of Americans cannot taste bitter, which is interesting. I thought that was an interesting fact. So remember that if you're using that Vitrex solution and you have a staff member who can't taste, they're not going to be able to taste the bitter. And then 15% of adults worldwide may have some type of alteration in their taste or smell. And then record keeping is important. So employers are responsible for record keeping. The results of an employee's fit testing and maintaining those records are the responsibility of the employer. Information in the fit testing records must be maintained until the next fit test is administered. So you have to keep those records at least for a year, whether that's if the employee has a physical change to their face or annually. Each employee's respirator medical evaluation questionnaire, again, just kind of reiterate, must be kept and secure to avoid violating HIPAA. A staff member's manager, supervisor, or employee should not have access to the completed questionnaire. I can't tell you how many times I've been in facilities where you walk in and they have the staff members' questionnaires in a binder sitting on a bookshelf for anybody to access. If anybody was to get a hold of that binder, they can obtain a staff member's medical information, that protective health information. So it is your responsibility to keep that information protected. An employee's manager, supervisor, or an employee should only know if the employee is approved or not approved to use a respirator. So again, the manager, supervisor, they are not permitted to have the information of the test results. All they know is if the individual has been approved or not approved for the respirator. Again, medical records are to be kept confidential and separated from other employee records. So again, keep those medical evaluation documents away from timesheets and any training education material that you may be keeping in their human resource records. For OSHA's respiratory protection standard that I talked about earlier in that standard 29 CFR 1910-134, the fit tester should be recording and documenting the following information. So if you are utilizing a OSHA approved record, this information is already applicable. It's already there for you, but you want to make sure you're completing the record according to standard requirements. So you want to make sure you have the name of your employee, as well as the specific respirator that was tested, the type, make, model, and size, as well as the type of test. So if you used a qualitative fit test and document which agent was used, you want to make sure you document the date of the test, results of the test, meaning was it pass or fail. Facilities and organizations should be using a qualitative fit testing record and securely filled out and filed. Some updates regarding the N95. Skilled nursing facilities, our staff are no longer required to routinely wear a respirator when providing resident care or in areas where residents may have access for any purpose. However, N95s or respirator use is required for staff that are working or providing care to any resident who tests positive for COVID-19 or may have positive, or should say, if they have, or demonstrating, I should say, sorry, any COVID-19 symptoms. So, months ago, we were all having to wear N95s in long-term care. However, it's no longer required. It's only required if you're providing care to an individual who has tested positive for COVID, has symptoms of COVID. So you want to make sure that you understand. And also remember that a K95 is not the same thing as an N95. So sometimes staff don't understand the difference between those. So you want to make sure you're providing that education to your staff as well. Some takeaways that you can take away from today's presentation. So if your facility has not already, be sure to develop a respiratory protection program, have a written program in place. If you've already have a written program, make sure you're reviewing it annually and that you revise it as needed. You want to make sure you're selecting and identifying a trained licensed healthcare professional to perform your fit test. Although a licensed healthcare professional is required to conduct a fit test, being they are required to review the respirator medical evaluation questionnaire, it is more efficient to designate the entire process to a licensed healthcare professional. A respirator medical evaluation questionnaire must be completed by the employee using the facilities or the employer's documents and reviewed by a licensed healthcare professional before any fit testing can occur. And then maintain confidentiality regarding all employees' respirator medical evaluation documents. This information should be handled as stated as protective health information to avoid violating HIPAA. Maintain completed fit testing records. So again, that qualitative respirator fit test record must be completely filled out. Make sure you include the employee's name. You want to make sure you get the employee's signature as well. Identify if fit testing conducted was compliant with your OSHA standard, the 1910 .134. This is usually a box that you'll find on that report or that log. You just want to make sure that it's compliant with your OSHA standards. You want to make sure you're documenting the type of respirator that that the staff member is going to be using, the make, model, style, and size. And then what type of qualitative OSHA accepted fit testing protocol was used, meaning specific to the type of solution that was used when the staff member had passed their test. If the individual passed or failed, you want to make sure you document that information. And the date the test was performed when testing several employees, be sure that the date of the test is accurate. So a lot of times I find that the fit tester will perform a test on Monday and then use the same document on Tuesday. So you want to make sure that you're using a record for each day that you performed the test and it's dated appropriately. Want to make sure that you include the name of the tester. If more than one tester utilizes, you want to make sure you use a separate record for each tester. And if the employee was unable to be fit tested, you need to explain why, and then give an explanation if you have recommended that staff member to follow up with a physician or licensed healthcare professional. In addition, provide more than one type of respirator during testing. Not all staff will be utilized the same model, make, and style of respirator. Keep that in mind. Be sure that all steps regarding the procedure of fit testing are followed. This includes all 8 exercises for the full time required for that full 1 minute. Identify any and all possible risk factors that could complicate or alter an individual's fit test. Again, just kind of reiterate that 15 minutes, they should not consume any food, anything that could alter their taste. And then make sure that you are not providing source control in regards to respirators to children, patients, visitors, or residents, or anyone restricted for medical reasons from wearing an N95. So I often will see visitors come through the front door, and I've seen receptionists hand a visitor a respirator instead of a surgical mask. And remember, those are not the same thing. So keep that in mind, that you should not be supplying a N95 or a respirator to any visitor because these individuals need to be tested appropriately. So you'd hate to, would not want to give an N95 to a visitor and then find out that for some reason they couldn't wear it or they had a medical problem and that created complications. So those are some takeaways that you can take away from today's presentation. And if you have any questions, there is my email address. Please feel free to reach out to me if you would like any information regarding, again, the OSHA requirements, any the records, like if it's the logs, if you want that information, whatever your information that I can help provide you with, please do not hesitate to reach out. And then I provided you with the resources that I used for today's presentation.
Oh, all right. Thank you. Thanks, Amy. That was a great presentation, and there's definitely a lot of material that goes into this presentation, and that, a lot of things that everyone needs to know about fit testing. There were a few questions that were in chat, but we are over. And I know that a lot of our audience had dropped off because we all have commitments. But what we're going to do is Amy and I will work together through the questions that you have sent to us, and we will send all of you an email with a response to the questions that you had for us in chat. So I don't want to take up any more of your time. Thank you all for being here. And Amy, thank you for such a great presentation. And we'll see you all in about 2 more weeks. Bye-bye, everyone.